Good afternoon, everyone. Are you all awake? I know it's after lunch. Did you all have coffee? Hopefully, yes. Thank you for that kind introduction, Claudia. Thank you to all the organizers for inviting me to speak to you today. It's really a great pleasure. I enjoy speaking to students, and this will be interactive, so please do answer when I call on you. Otherwise, I will actually point a finger and you'll have to answer. Okay, so we can start. So the main challenge that we face today as global surgeons is the fact that 5 billion people do not have access to surgical care. Imagine that, 5 billion people. So that's 2 out of 3 in the world do not have access to surgical care. And the consequences are devastating. 17 million people die every year because they do not have access to surgical care. And it's really a lesson in inequity. So there is inequity in the distribution of resources. And as you can see on this map, there are more resources in the north compared to the south. There is inequity in the distribution of human resources. And so in this map, the darker the green, the higher number of surgeons, anesthesia providers, and obstetricians. And so you see that all these surgeons and anesthesia providers are concentrated in the north. And when you look at the map of Africa, it's quite light. It's yellow, light green, which means that they're practically, the number of surgeons and anesthesia providers are inadequate in those regions. You also find that in those regions with no human resources, with high levels of poverty, those are the regions that also have the highest burdens of surgical need. And so East Africa, for instance, has a need of more than 6,000 procedures per 100,000 people. And you compare that to North America, which has a need of 4,000 per 100,000 people. And this just came out this month in The Lancet. A group of surgeons, providers in Africa looked at outcomes following surgery in Africa. And so if you're lucky enough, if you're one of the 3 who gets a surgical procedure, the outcomes are not as good. So mortality is higher. So the barriers to getting surgical care are great, but even when you do get the surgical care, the outcomes are not as good. And when we consider global pediatric surgery, things are even worse. So you may have a general surgeon, but very, very often you will not have a pediatric surgeon. You will not have an anesthesia provider who can give anesthesia to a newborn. So the challenges in human resources are even greater for the pediatric population. And of the 5 billion people who lack access to surgical care, 2 billion of them are children. And the other fact is that the poorest regions with the least number of surgeons, anesthesia providers, and obstetricians, and the regions with the greatest needs also have the youngest populations. I'll give you some concrete examples. So I spent a year in Haiti. Haiti is an island between the Caribbean Sea and the Atlantic Ocean. With a population of 10.5 million, 42% is pediatric, meaning that there are 4 million children in the country. Half the population lives on less than $1 per day, and there's 1 pediatric surgeon, and he's in private practice. Okay? Which means that children do not have access to a pediatric surgeon in Haiti. In Western Kenya, same story, population of 7 million, 43% of that population is pediatric, meaning less than 15 years old. 35% of the population lives in poverty with less than $1 per day, and there's 1 anesthesia provider for 7 million people. In Sierra Leone, the population is 7 million, 43% of the population is pediatric, 60% live in poverty, and there's also 1 pediatric surgeon who lives in the capital city. And so how is it possible that we've gotten to this point where 5 billion people do not have access to surgical care? And 2 billion of those people are children. Number 1 is that there's no political support. I don't know if anyone has heard of a politician saying, "I want surgery for everyone." Has anyone heard that? Trump? I'm sure has not said that, that's for sure. And with no political support, you will not get investment. So governments will not spend money in surgical care because they think it's too expensive. They'd rather spend money in vaccinations, which is not a bad thing. But at the same time, the needs are also great for surgical care. Surgical care is still not a priority in global health and in public health. And right now, health systems are just not prepared to provide safe surgical care. So with one surgeon for 7 million people, or one anesthesia provider for 7 million people, there's no way you can provide safe surgical care with that, with a workforce that's so inadequate. This slide here just illustrates where money is spent in global health. So the majority of funds go to HIV, TB, and malaria. They get $4 billion every single year. Surgery gets 0. And I mentioned to you earlier that without access to surgical care, 17 million people die every year. And despite that, 0 funds are spent in surgical care. The other sad story about the world we live in right now is that there are wars everywhere. And UNICEF recently said that 2017 was a nightmare year for children caught in war zones. And really, so in addition to not having a workforce, to not having the infrastructure, we have wars going on right now affecting children around the world. And these are very scary times. We have leaders that are scary, to be honest. Nuclear war is a real possibility. There's Brexit. There is extremism. People are going inwards. We are fragmented. We've lost the vision that we are a global community. We each depend on each other, and we're all here to make sure that everyone lives a dignified life, and everyone can live in peace, and everyone can have a fulfilling life. So at the moment, at least in my opinion, we're heading in the wrong direction. So what is the solution? There is. Give me some answers. Louder.
Education.
Yes, education.
Redistribution of funding.
Yes, redistribution of wealth. So more equity. Education. Yeah, great examples. Anything else? More
medics working abroad.
Okay.
Isn't it better to have the medics from the country?
Yes, so local capacity building is critical, because you can go, and then when you leave, what happens? Right, so unless you're going to build capacity in partnership with your host community to make sure that you're leaving something that's sustainable over time. But definitely building a workforce. And sometimes it does involve some movement of groups, yes. Anything else? From that side of the room.
You might have to pick someone.
Do I have to pick someone, really?
Population control?
Population control? There are too many children. So, family planning, you mean? Yes. But then I'll run out of work if there are children. Yes, but so the response response needs to be integrated, yes. So if a country, the population growth is outstripping the resources, then that could be considered as part of the solution, yes. Anyone else?
Encouraging preventative measures, so that children aren't in the situation
Yes.
less disadvantaged.
Yes, so that's important. So in addition to working on infrastructure, equipment, our workforce, prevention is also key. So for injury, for instance, make sure that we reduce the number of burns or reduce the number of road traffic accidents, seatbelt use, and so forth. Okay, great. Thank you for answering. And actually, there've been some advances recently that give me hope. So in 2015, at the World Health Assembly, a resolution was passed to include essential surgical care as a key component of universal health coverage. There was the Lancet Commission, chaired by the Harvard Group, that really defined the scope of the problem. It's from this commission that we get the 5 billion number. And most recently, the Global Initiative for Children's Surgery was started, and they've been working on defining minimum standards in terms of infrastructure, in terms of our workforce, for safe surgical care provision. And your answers are coming up here in terms of building a surgical workforce, a local surgical workforce, investments in infrastructure, which may require involving the private sector, which I think will be part of the solution in the future. And there's got to be a community strategy as well, because you can have the best hospital with 15 surgeons, but if the community doesn't trust you or they don't believe that you're a solution, you wouldn't go anywhere. So you need to work on the supply side, which is investments in infrastructure and the workforce, but also on the demand side. You need to work on the community to educate them, to say, well, when your child has a hernia, you need to take them to the hospital to repair the hernia before it gets incarcerated and they need a laparotomy. I think the solution is you. Do you agree with me? I see some heads saying no, maybe yes, a little bit. No, I mean, you guys are the next generation, and our generation is leaving you with a lot of problems that you will need to solve, right? And today's generation, you guys, apparently you're the brainiest of all generations, most tech savvy, most connected, most creative. So I believe you guys can solve the problem of this 5 billion people not having access to surgical care, okay? And I challenge you to get involved. And the reason I say that I believe in you guys, like all the projects I'm involved in, that I've been involved in, have included your generation. So in this slide, you'll see my team members from Haiti. So in Haiti, over the course of a year, we were able to do local capacity building, and by the end, I was not even scrubbing into cases. This bottom left picture, those are 2 residents doing a hernia repair on their own in a child. And we looked at outcomes, which were similar, whether I was doing it or they were doing it, the outcomes were the same in terms of complications and in terms of mortality. The other pictures are of my team members in Nicaragua. At the moment, we're working on improving access to surgical care in northern Nicaragua by investing in infrastructure, investing in training, and also investing in community education. And it's all done by you guys, actually. I'm only there, supporting, but the work is being done by you. And what's important is to use as guiding principles equity, social justice, and empathy. And in the next few slides, I'd like to give you a few lessons that I've learned along the way as you embark on what you choose to do. I challenge you to get involved, and more than just tweeting and posting on Instagram, but actually finding a cause and putting everything into the cause. So as we all know, nothing just happens, right? You agree with me?
Yes.
So, who wants to be in the group that makes things happen? Great. Who wants to be in the group that notices that things need to happen? Okay, hopefully we'll recruit you into group number 1 by the end of this talk. And who wants to be in the group that is wondering that something is happening? None of you. Great. Okay. All right, so we all want to be in the group that makes things happen. Okay, so now I'm just going to share with you some of the things I have learned along the way that have helped me make things happen. So first of all, you need a team. There's no way you can do everything by yourself. And make sure that you take care of the people that you're working with. Invest in relationships, and you'll figure out that through your interactions with them, you actually come to depend on them more than they depend on you. Okay? This is my team in Haiti, actually, with residents, nurses. There's an anesthesia provider who is great with children. Because as a surgeon, if you don't have someone who is comfortable giving anesthesia to children, it's really not fun. Because you can have a successful procedure, but then the patient doesn't wake up, and that's a problem. Okay? So you need to make sure you build your team in the hospital. You need to invest in relationships with the nurses, with the residents, with the anesthesia providers. When you need to do a procedure at 2 a.m., sometimes it depends on whether they like you or not. If they don't like you, it's not going to happen. If they like you, you may be able to convince them to go to the operating room at 2 in the morning. Know who's doing radiology. Same thing. When you need to get things done, it makes things a lot smoother when you actually know the people and you've invested in them and they know you. Know the blood bank tech. In Haiti, the response when I asked for blood was, "There's no blood." Okay. But if I went there and spoke to the person, all of a sudden it was miraculous. I would get blood. Same with the pediatricians. They formed our team, and because many times when you go to these places, the children have other issues in addition to their surgical pathologies. So they are anemic, they are malnourished, and you need to make sure that you optimize them before you take them to theater. You need to make sure you correct the malnutrition, correct the anemia, and pediatricians were instrumental in allowing us to have good outcomes. Involve the family members. Initially, when we started, for neonates especially, a lot of them were dying because we just did not have the infrastructure to provide neonatal care. And so what we did was we involved the mothers, so that we would have the mothers come to the recovery room, begin breastfeeding immediately after surgery, and so the baby got the calories, the baby was kept warm, and those babies were 6 times less likely to die when the mother was present. And so we used what we had to assure optimal outcomes. Build your team outside the hospital. Be friends with the driver. So initially, I find myself walking home at 4 a.m. With wild dogs around. But once I knew the drivers and who to call, then they will take care of you. Make sure you learn everyone's names, meet them, find out how their families are doing. That's very, very important. Be humble. Someone spoke about this earlier today. Listen, especially when you first arrive. Make sure that you're doing more listening than talking. The people you're visiting are actually experts about their condition. And if they're doing something a certain way, there's probably a good reason why they're doing it that way. And make sure that you're going as a partner, not as someone a world expert coming from I don't know where, flying in to tell people what to do. That model doesn't work anymore, and should not be done. And so you want locally defined priorities, locally defined solutions, and ask questions more than anything. Learn the language, that's very, very important. Where is the student who wanted to go to Bangladesh? So, are you multilingual? Okay, so you speak?
I speak English fluently, I know a bit of French, and I'm starting learning Spanish now.
Oh, great, you're like, speak like 5 languages. Okay, great. So it's very important to learn the language. Language bridges distances. It immediately brings you closer to your host. It strengthens relationships. I learned French Creole while I was in Haiti that year. Initially, I thought I was speaking Creole, but apparently I wasn't because the residents would translate my Creole. But once they stopped translating, then I realized that I was getting better. So I even, at the end, I was running clinics on my own. And so it's very important to learn the language. And there are other benefits to learning multiple languages. It apparently sharpens your cognitive skills, your attention improves, it lowers your risks of dementia, and you can multitask. And apparently when you're making a decision in another language, you apparently come to better decisions because you're more objective and you're less emotionally involved. And use apps. I use Duolingo, and I'm learning Spanish right now since we have someone in Nicaragua. At the very least, if you're not going to learn the language, at the very least, learn how to say hello, please, thank you, and may I. And people appreciate that. As I said earlier, invest in people, be a giver, teach, work really hard. I mean, the whole time I was in Haiti, I was on call every single day. So anytime a child came in with a surgical problem, I was there, be available, take on more than the minimum, so it's not a holiday. Do unpleasant tasks that no one else wants to do, and that's how you build trust, respect, and actually influence in your host community. Also, take care of yourself. So this is Haiti, actually. You don't usually see these pictures, and so if you burn out, then you won't be useful to anyone. So you need to make sure that when you can, that you sleep, that you eat, and you take a bit of time off whenever you can. And I found through that experience in Haiti that building a team, investing in relationships, giving, really paid dividends. We were working in a 300-bed hospital, serving a population of 3.4 million. We started a program in pediatric surgery in 2015, and we saw pediatric surgical volume double, and our outcomes were actually quite good. No deaths for elective procedures, a 3% complication rate for elective procedures. For emergent procedures, mortality was higher because many of the patients would present quite late, and a lot of those patients who died, as I mentioned earlier, were neonates, and we didn't have the infrastructure, and a 6% complication rate. So what can you do to prepare? So you have to complete your training. So I would suggest not going before you finish your training. So it's better to finish your training and be a fully trained surgeon before you go. Otherwise, they will end up having to take care of you rather than taking care of other things that need to get done. The other reason why you need to be well trained is that you will see pathologies that are actually well advanced. So you need to be careful, you need to be ready, and you need to be comfortable as a surgeon because you will be taking care of pathologies that are more challenging than what we normally see. scrub with your friends who are in obstetrics. I go on mission with, I do missions with MSF, and you should be able to do C-sections. Plastics and burns are important, so you should be able to take care of burns especially, and also get some exposure in orthopedics. It helps to have an exposure in public health, and just so you can understand the big picture, and also to figure out how you can speak to others who are in public health, because they don't speak the same language. If you're a surgeon and you're in a room full of public health specialists, they're different. And the way they see the world is different from how we see the world. And it's good to spend time with them, just so you're able to converse with them and see their perspective. Be a team player, so as a medical student, as a registrar, be a team player, and make sure that you're pulling your weight. Read, practice, prepare, find a supportive environment, a mentor who shares your values, your goals, and as I mentioned earlier, make sure that you're keeping equity, social justice, and empathy as your guiding principles. Thank you.
Thank you very much for the presentation. That was amazing. I didn't know any of the figures. I realized it. The only thing, what's your opinion on redistribution of wealth in the sense of optimizing the system? If we distribute the wealth from the wealthier countries in the world, the less fortunate ones that were ravaged by war and famine, if we give it to everybody, then it's sort of like a small help to everyone that is not actually going to optimize the system. It's not going to improve the healthcare system. Instead of choosing, let's say, 5, 10 countries, then we can increase the resources towards them, make them self-sustainable, and make them able to generate their own doctors, their own surgeons, that in turn can help the countries that are neighboring to them. Instead of giving a little bit to everyone and saying sort of like Mr. Hunt says that we're increasing by 20 million when actually if you look at a big hospital, their income in a year that they require is about 500 million, and saying that we're giving 20 more million means nothing. So instead of helping everyone, helping a select number of countries that need it the most, making them self-sustainable, and then moving on to the newer country that needs it the most. So making a ranking list of who needs the help the most, and sort of doing one by one instead of helping everyone and not changing the situation that much, and making like a 20-year plan where they can generate their own surgeons, their own doctors, and they can grow on their own.
I think it's actually not even a matter of help, because if first, number one is actually political stability. I was in Congo a few months ago, and Congo is rich in terms of natural resources. You know, anything you want, diamonds, oil, everything. And if there was political stability and no corruption, Congo could actually take care of itself without any help from anyone. And there was a map I recently came across. When you think about all the resources that come out of Africa, for instance, through the private sector, and you compare that to what is coming in as aid, actually Africa is financing the rest of the world. And so it has to do with political stability, eradicating corruption, and actually making sure that the private sector is accountable when it comes to making sure that populations where they're extracting minerals actually benefit from the profits that they're making. So in terms of health, they need to be, some of that money needs to come back for health for health and for education and so forth. So I don't know that the aid development model is the model we should continue with because it hasn't really made a huge impact. I think what would be more sustainable over time is just making sure that there's political stability, no war, and making sure that private sector is accountable, and making sure that there's good governance. I think that will take us further ahead than aid.
Thank you. I just had a question as well. So I know that Haiti is on an island with the Dominican Republic, which is is rich because of all the tourism. So I don't actually know myself and might be quite stupid, but I know a lot of people go from Haiti to Dominican Republic. Would a lot of people who need medical treatment go there as well?
There were quite a few people who would go to the Dominican Republic from Haiti for medical care. Yes, that happens. Yes.
So does that help with the problem that's in Haiti, or do people who really need it can't make it to Dominican?
No, it doesn't really help because in terms of follow-up, and because a lot of the pediatric surgical diseases require long-term follow-up. And so they would get one procedure, spend all their money, the family would be impoverished, and then they come back and there's no follow-up.
Any other questions?
Just a quick question on, is there a particular formal training to obtain or get involved with things like this?
General surgery. So I trained as a general surgeon first before training as a pediatric surgeon.
So, well, what I mean, so after you've done your foundation training, did you go right ahead and go to countries like Haiti? Or do you need to?
Oh, you need to be at the consultant level.
You need to,
Yes.
One last
But you can go now to help with research, to go as something but not clinical. To actually be helpful and not a hindrance. And if you want to do clinical work, you need to be at the consultant level.
One last question?
Yeah, so are you involved in implementing a infrastructure within the countries that you go to generate more pediatric surgeons without having to kind of bring them in? So is that something that you do actively?
So in Haiti, we really concentrated on training the general surgery trainees to be able to take care of children. And we were there over the course of a year. And by the end of the year, they were doing procedures on their own. They could run the clinic. The clinic still runs even today. And so I think in the long term, yes, we want more pediatric surgeons. But in the interim, we need to also train the general surgeons to take care of children. Because there are more general surgeons right now than pediatric surgeons.
Okay, thank you. Thank you, Dr. Kaseje.